Today I'm going to be showing you how, a technique that I use called the Graston Technique, and it's essentially a myofascial release technique where I'm using instruments to break up scar tissue or mobilize tissue. These are the instruments that I use. Again, it's called Graston, Graston. Usually I'll use an emollient. This is a mixture of beeswax and mineral oil, so it helps the instruments glide along the skin easier. The set itself looks like medieval tools, but essentially each one is contoured to make treating a different part of the body easier.
So I heard you have that patellar tendon one. That's that's where all my knee pain resides. You know, all up and down here. Originally, when I looked into Graston, that's what I wanted to have done. Was
Right through the patellar tendon.
All of that, yeah.
Ooh, that's good stuff. Well, let's start on the knee then. So let's have you lay on your back.
You want to do it?
Yeah,
Okay.
let's have you lay on your back. We'll start on the knee. Oh, I really want to.
Yeah.
Now, the technique itself shouldn't be too painful, but what we look for is to get in there, get some blood flowing, but not cause too much pain. So feedback's important. I'll usually ask, the patient, just let me know if it's too much pressure. Mike's pretty good about giving feedback. Kind of here.
Doesn't hurt at all.
Yeah, it sounds like I'm scraping the bone, but really it's just breaking up the tendon. It's kind of like a very superficial massage. It's not like deep tissue work, but you can see the red where we're getting blood flow. Some people will even end up bruising a little bit.
Surprised, I actually thought this was going to be painful. This isn't bothering me at all. Completely painless.
Oh, that's a good one.
Could hear all that stuff in there though, huh?
Yep.
This is probably going to make my knee feel so much better. Can I describe what I feel?
Yes.
Like, essentially after I get scraped, I feel like my body has been oiled up and everything glides smoothly.
Like an oil change for the muscles.
It is. It is. A lot of what I thought was like joint problems are really just scar tissue buildup and muscle issues. That sounds great.
Yeah, when we get into the bigger muscles, you really start feeling it. So here we got the handlebars. We're working quad and IT band. Again, trying to get some pressure off the knee. Ooh, that's a good one in there.
Oh yeah. It's amazing that this doesn't hurt at all.
And I don't pay him to say that. He pays me.
Yeah.
Yeah, I think the oldest patient I've had that I've treated, 92.
Oh yeah?
Yeah, I came in for just some carpal tunnel stuff.
That's awesome.
And same thing, they actually a lot of times prefer this because it's gentler. They're worried
Versus like
anything intense joint mobilization can hurt. And so they actually like this type of treatment. It actually feels pretty good, like you said.
What's weird is like when I first looked this up, I thought it was a really aggressive type of treatment, and I think it almost has the effect of an aggressive treatment, but like definitely not the pain or the discomfort even. I mean, I don't really feel discomfort at all when I come in here.
But yeah, it looks a lot worse than it really is, and it actually feels pretty good.
And it's subjective, like each patient reacts differently, right?
They all react differently, yeah. Alright, so I'm going to have you bring this leg over for figure 4. Out of all there's 2 places that I treat that are pretty sensitive. Adductors
Yeah, that
and
one
subscapularis are pretty sensitive. But in order to get there, you want to use the tongue depressor to get into those muscles and try and break some of that up.
No, this one I can't lie and say it's not painful.
Watch them wiggle.
Yeah. I find that if I wiggle my toes, it helps a little bit. This is my good side.
But this is a great one for a lot of my patients who bike or run will have problems with these muscles. It's a hard muscle to stretch, so they can foam roll the outside muscles, the quads, the hamstrings. These ones are hard to get to.
Yeah, I actually have a problem with muscle overlap on both legs.
All right.
On this side, it's bad. My friend Lyle was separating them yesterday.
I can see. He left his mark. So, just for the record, this bruising is not because of me. This is the massage therapist.
Yeah.
Shout out to Brentwood Therapeutic Massage.
Good people.
Looking good through there. Now this is a sensitive area, so oftentimes people may be resistant to this type of treatment, but it actually it doesn't take a lot of pressure to get a good response. And usually there's little to no pain. Sometimes around the bottom part of the heel where there's inflammation, I'll have patients say, okay, yeah, I feel it. But as Mike will tell you, there's really not too much discomfort associated with this particular treatment.
It's completely pain-free right now.
This is a great treatment for patients who come in and say, I constantly am rolling my ankle. You can actually take the instrument and go all along those little areas.
That's something I roll my ankle all the time.
And one of the most interesting studies that I found on this technique is where they actually took rats and did this treatment on half the rats after they had basically a surgery on the Achilles to repair it. Half the rats they did this technique on, and half of them they did not. And the subjects that they actually did this technique, the scraping technique, once they tested the strength of the tendon afterwards, they actually had increased strength of the tendon. So this can actually increase,
That's cool.
speed up the recovery. So if you had surgery in the Achilles tendon, This is an excellent type of treatment for post-surgical treatment.
The body was able to heal itself.
Heal itself better.
Yeah,
Stronger.
yeah, that's really cool.
Once I get the tendon, blood flow through the tendon, I'll take my finger and do a little bit of muscle pinning or active release technique. I'll get in there, pin the muscle, and make sure we got good movement through the calf. Again, this is another common cause of pain in the back of the heel, even leg pain. This pain can translate all the way up to the knee. Another common problem that I have in my clinic that patients will come in with is plantar fasciitis. Now, plantar fasciitis in itself is pain on the bottom of the foot due to inflammation or scar tissue buildup. So oftentimes patients will come in, complain of pain first thing in the morning. They'll complain of basically getting out of bed and feeling like it's stepping on glass, that sharp pain. And then once it loosens up, oftentimes they won't have pain until later in the evening. So the way I treat that is a two-step process. I'll start with using a Graston tool. This is the blade of the knife, and I'll go in there, and this is a sensitive area. People are often ticklish, and so I can.
I'm already starting to laugh.
Yeah, I can desensitize it just simply by changing the angle of the tool. If I go straight on, it's going to be a little harder to tolerate than if I go at an angle. But essentially, the tool has a beveled edge that's smoothed out and allows the tool to glide along the plantar fascia, or the muscle along the bottom of the foot. This is one of those techniques that a little bit of pain can lead to big results, to feeling a lot better.
Well, I don't feel any pain. Do you do any ART stuff like in the feet?
Yeah, that's a great question. So you can do ART on most any muscle in the body, but specifically for the feet, I find that oftentimes if I just scrape the muscle and then tape the muscle, support it, that speeds up the healing process quite a bit. And you may not need really deep work.
Mm-hmm.
And when I'm treating plantar fascia, I usually will go back to the Achilles just to make sure we don't have tension there. Again, because tight calf, tight Achilles tendon can lead to dysfunction in the foot, lead to increased pressure on the foot, leading to inflammation in the bottom of the foot. So we got him on his back. Let's do shoulder.
So before I had this shoulder problem, I actually had like chronic tightness in my.
So the
I guess he wants me to
adductors
shut up.
and the subscapularis, the two tender ones. Watch them squirm.
It really doesn't hurt. It's more, it tickles.
What were you saying before the shoulder problem?
So, I've always had chronic neck issues, which I believe come from my traps, but mainly on my right side. You know, super uneven, super tight on my right side, and I don't know if this side maybe has started to fail.
A little compensation.
Compensating, or. funny, like one thing is almost not excruciating, but one thing's painful. One thing tickles.
Yeah, well, this this spot is it's one of those areas that we haven't worked a lot.
Mm-hmm.
And you can actually see here, there's some where the capillaries are breaking up. You know, a lot of the places where we've already worked, he doesn't get too red, but this is a new spot, which when we taped up actually helped. So I think this is a
good spot to work.
Yeah.
Mm-hmm.
Plus the fact that every time Mike comes in, he points here and says, "It hurts here. We need to fix this." And I say, "No, we need to fix everything else first."
Sounds great. It's good. It's good noise though. It means we've discovered something.
We don't even need to dub over this. The sound is already bad enough.
Sounds like you have that one instrument. I don't even know what it's called. The two sticks that you rub together. Oh man. I was actually going to ask if you could dig in, like, down in this area, like, because I've been having, like, instability and pain, like, in low in the joint.
See this guy, perfect patient. Just scrape me everywhere.
Yeah. I'll stay here all day if you want to do this to me. I wouldn't keep coming back if I didn't get the benefit that I was getting from it. I mean, it's like been life-changing for me. Some of these problems I've had for years, and they're starting to go away in a matter of weeks.
All right, let's have you sit up.
All right.
Okay, so I'm going to get into the elbow. A lot of patients that I have that come in will have complaints of pain on the outside of the elbow. They'll have pain here on the bone. They'll also may have wrist pain or trouble.
On this side.
There we go. Trouble grabbing things. And so, and some of them will notice just pain when they do a push-up, and they'll feel it right in the wrist. And so sometimes they'll say, "My wrist hurts. I've got this problem in the wrist." There's no history of trauma, so when I start ruling out some things, I realize it's not in the wrist. It actually is up in the arm, in the forearm, and the elbow. And usually right through here, we'll feel some tenderness, some irritation, some inflammation, and then some knots through the forearm extensors. And so what I'm going to do is I'm going to show you what I do for the treatment for tennis elbow, which is initially make sure that we're dealing with some pain, which is usually pain, again, in this position or this position. And
which I do have sensitive wrists on both sides.
You do? Okay.
Yeah, I mean it's
the tight muscles.
Yeah, you could already feel it.
And it's thready. You know, it's got this. It's like a little twang in there when I pluck it. So I'm going to get in there.
It should be a little bit more supple, right?
Yes, yeah. I'm going to get in there and work the fibers of the muscle, try and break up some scar tissue. But my treatment protocol for this problem is usually scraping and taping. So change the pressure point from here to down here where the muscle belly can take more of the pressure and let this heal. And then anything to decrease inflammation. You can use ice, supplements, but initially we'll just scrape it and tape it and see if we can get pressure off. So scraping, again, this is one of those sensitive areas that you think would hurt really bad, but most people don't feel too much pain, even though it sounds like we're scraping right on the bone.
It's always in these places where I don't feel it at all, and I'm like, you can push harder.
And that's another thing is when people see this technique, they think, okay, it requires a lot of pressure. And the truth to this technique itself is since we're just decreasing some of the muscle tension, breaking up myofascial adhesions, and increasing blood flow to the area, it doesn't require a lot of pressure. And even when I do put a lot of pressure on, you don't feel that much.
Mm-hmm.
So it's not the same as like a deep tissue massage, although oftentimes with this problem, I'll get in there with my thumb and do a little bit of active release technique, ART, or muscle pinning, where I'll pin the muscle and then move
Through range of motion,
yeah.
right?
And that's where usually we can get into those knots and
Yeah.
feel them, and then get the muscle to move a little bit easier. But the Graston technique itself is not necessarily all about causing pain or getting deep.
Definitely.
It's actually more superficial. So Mike, what we're going to do is just use the blade or the scanner and see what we can find through here. We've already done some work on the lower part of his arm. We're just going to see if we can break some of that scar tissue up. Get some blood flowing to the area.
This is probably the most redness I've ever experienced right here.
That's good stuff.
Yeah.
That's the stuff I work for.
Mm-hmm.
You got to work a little harder.
I was hoping it was going to be like this today. Oh man, that feels great. Oh, you're right about the tenderness there. You know, it's like something I have on both sides.
Mm-hmm.
It's just a problem that's starting to almost snowball, I guess you could say. So, put a stop to it.
That's what we do here. Put stop to the pain.
It's really amazing the work that you're doing here, man. I'm telling you, like the chronic pain I've lived in for all these years has caused me like bouts of depression, you know, loss of motivation, all these negative things, and I've started to see a turnaround in my mental, like my mental health, man, from getting this stuff done. So, thank you. I'm grateful for it.
My pleasure. So we're also doing a little tricep. I want to get in there, feel the knots.
That feels great. You're doing good stuff.
There's muscles that, again, are pulling the shoulder the way they shouldn't.
Mm.
So hold your arm here, and then I'm going to actually have you do the work.
So
bend the elbow. There you go. Good. Give me a little leverage. There we go. Perfect. All right. Next, we're going to get into the trapezius muscles. Big shoulder muscles. There's two muscles that I focus on here in the shoulder. The first one is the traps, and then the levator scap muscle. This muscle here is often a common cause of the neck locking up or neck pain, especially if you sleep wrong and then you wake up, you can't turn your head. I'll find that this muscle is in spasm. Now, I don't recommend doing a technique like this when the muscle is in spasm, but once that spasm calms down, oftentimes you'll be left with a lot of tension in that muscle. So I'll get in there with something like the Graston tools, break up, release the muscle, increase blood flow to the area, and let the muscle heal. And Mike, again, he's doing a lot of weightlifting, and so sometimes head comes forward and causes extra stress on these muscles. So I want to work these muscles, increase blood flow to see if we can get some pressure off that area. Usually start with the scanner, which is like the blade. And again, the trapezius muscles, most people just think of right here, this muscle here. Trapezius goes all the way up and then down like a big triangle. But that's just the upper trapezius. We also have the lower trapezius muscles down here, and they actually go down to the bottom part of the shoulder blade. So when we're talking about trap muscles, it's almost like, a big triangle, but all the trap muscles would form a diamond. So don't forget the lower traps when we're talking about the upper traps.
And it's very important to work those lower traps
Yes,
as well.
Lower traps, antagonist muscles.
Mm-hmm.
So if we can activate these muscles, that can relax the upper traps.
Mm-hmm. Something I'm working on.
Alright, next I'm going to use the tongue depressor and get in deep to levator scab. When Mike first came in, this is where we found a lot of scar tissue or grittiness. It's actually starting to smooth out pretty well. And once we break that up, what I'll do is I'll get in there, do a little muscle pinning. So head comes back, pin the muscle down, rotate away, you can feel the tension through there. Again, good. That's a good one right there. Perfect. Yeah, sometimes with the ART, you will get a little pain, but actually a lot of relief to get that muscle moving, increase blood flow, decrease tension.
I'm gonna do it again.
No.
Okay.
So now we're going to look at part of the rotator cuff, the supraspinatus. Supraspinatus muscle goes at the top part of the shoulder blade. So if you feel that little ridge or the spine in the scapular shoulder blade, you go just above that and there's a little dip. You have to go under the trap to get to it. But this instrument is perfect for going along that rotator cuff muscle. And oftentimes you'll get knots that will develop through there. The best test for that is the empty can test. Have a patient bring their arm out, thumb down, press up against me. Should be at an angle. Any weakness or inability to press is a sign that we may have rotator cuff problems or supraspinatus problems.
So I'm very happy to know that I do not.
Mike's got a negative empty can test, which is good.
Now, before when you had me do that, I actually was a little weak, but we've narrowed it down to it just being subscapularis and bicep. So, very good news for me.
Second muscle I hit, supraspinatus, is the infraspinatus. So right below that spine is a muscle that covers the bottom part of the shoulder blade or the triangle. And it's a broad muscle that if you press in there, there's usually a couple tender spots in there, pressure points, that if you hit them, sometimes it'll reproduce some arm pain. But usually a lot of localized tension. Again, you get in there with a tongue depressor and break up some of that tension, help increase blood flow to the area. And that's just a bundle of feel good, right?
It actually does. I mean, sometimes the chronic pain is so bad that once you start digging into it, it just feels like relief. This just feels great.
Third muscle, supraspinatus, infraspinatus, is the teres minor. Teres minor starts at the lower lateral portion of the scapular shoulder blade. So if we're just taking right here, go right under here. There's a little spot that's often tender in a lot of people. This can be, I find, from a lot of mousing. It's the computer worker's muscle, something repetitive. Teres minor.
Keyboard warrior. Oh, man.
That's a good one.
Yeah, yes it is. You never know until you start to really dig in there, huh?
Yeah, this technique is actually somewhat diagnostic as well as therapeutic. So that means while I'm using the tools, I can actually feel and get feedback whether that spot is an area that needs to be treated. Okay, so we have supraspinatus, infraspinatus, teres minor, and the fourth one in the rotator cuff is the subscapularis. Subscapularis means it's underneath the shoulder blade, so it's hard to get to. There's two ways to get to it. One is through underneath the shoulder blade, and the other one is by trying to get in through the medial border of the shoulder blade. So have him bring his arm back. That helps protract the scapula, and you can actually reach right underneath and look for knots to see if there's any tension through the subscapularis. Another tongue depressor. Get in there, separate that shoulder blade, get the pressure off. Mike's shoulder's actually pretty mobile now that we've been working on it all morning, which is good.
Feeling a lot better.
Time to go work out, right?
Mm-hmm. Feeling a lot better.
Morning.
Morning.
All right, for shoulder, that about wraps it up. So next what we'll do is a common cause of pain in between the shoulder blades is the rhomboid muscle group. And the rhomboids attached to the middle portion of the shoulder blade and then to the thoracic spine. So I'll have patients that complain of tension right in between the shoulder blades. And the exercise for that muscle is the row, or bringing the arms back. To get into those muscles, use the tongue depressor. And this is often described by patients as that itch they can't scratch, and that pain, that place that they can't really reach or rub themselves. So a telltale sign of this problem is people leaning up against the corners of a doorway to try and get into that area. You've done that before, haven't you?
Yeah. Wow, that's funny. I thought I was the only one. I find myself doing that a lot, all the time, actually.
So this particular technique is I'll scrape that muscle, get in with my thumb, and then an adjustment using my hands to get some pressure off that area is a perfect combination to get pressure off that area. And usually I'll have my patients explain it as just a big sense of relief. So I'm going to adjust Mike while he's here. Mike, go ahead and lay on your back and I'll show you what we do. All right, bring your arms together. I want you to take a deep breath in, breathe out. Good. Lots of popcorn. All right, go ahead and sit up. All right, he's got a nice knot right through here. So I'm going to actually do some active release technique where I'm going to have him bring his arm out and then bring it right across here. And as he does that, I'm going to put pressure on the muscles. So come on over here. Okay, Mike, bring the arm across and use that other arm to help bring it all the way over. Good. And you should feel a lot of tension through there. That's great. Perfect. Again.
Right there. Yeah.
And again. All right, let's do the other arm even now.
Did you hear that?
Yep, that's good.
I can actually feel my right side, how tense it is now. It's not as supple.
Again. All right, and that's a common treatment that I do for mid-back pain. When I have patients come in and complain of neck pain or headaches, what I want to do is check all the muscles around the neck. A common cause of areas of tension is right through suboccipital muscles, or the muscles that attach the bottom part of the skull to the bones in the neck. And one of the best ways to get to release that is some sort of traction. So oftentimes what I'll do is I'll check the muscles. If there's tension through here, I'll use my hands or use tools to get some pressure off the muscles. So today I'm going to show you a demonstration of the Graston Technique, which is where I'll use the tools to get in there, break up some scar tissue, increase blood flow to these muscles. And also for the headache, actually use the tools to traction the neck and get pressure off the base of the skull. So I'll start off with tongue depressor. It's an easy way to get into these little muscles of the neck. And although this looks like I'm like scraping his bones, it's actually just the muscles along the side. And he'll feel a little tenderness when I hit those spots where there's inflammation. But for the most part, it looks a lot worse than it is.
It's another one of those, well, this is tickling me, so I'm trying not to laugh actually right now.
All right, Mike, go ahead and lay on your back. All right, the instruments have a beveled edge, so it's not sharp, but it does allow me to get the proper amount of leverage into these areas, these little tight areas. And for this particular technique, what I'll do is I'll get in with the instrument, cradle his head with my hands, and then slowly rotate the instrument. So you can see the instrument kind of rolls along that muscle. At the same time, I'm going to actually use my hands to pull on the neck. And so I'm making him a little taller, or getting pressure off the neck. Right through there, you can feel that. And for me, it feels like I'm putting a lot of pressure on his head, but Mike will tell you he probably doesn't really feel
It feels
too
like
much
relief.
Yeah. Most of my patients say, pull harder, or try and dig in deeper.
Yeah, if you can. If you're allowed to. That's great.
So again, this is a great treatment for patients with headaches. Once I get the muscles released, I can get in there and do a neck adjustment. So we'll do one on Mike today. So, deep breath in, breathe out. I always check the levator scap, the muscle that goes into the shoulder blade, and on the right side he's got a little knot right here. Again, that muscle goes all the way up to C2, so it can cause muscle tension in the neck pain. It's that pain you wake up with after sleeping wrong. So usually when a patient comes in with this problem, we can get it feeling better within 2 to 3 visits.
That feels great.